Men and women, excess of coffee is bad. You drink coffee.
Yeah, a lot. So yeah, that is
down. This is PCOD. Why does this happen?
PCOD in relation to weight and
Egg will be alive only for 1 day. So during that time, the husband and wife have to have intercourse.
okay.
So that is what is.
Hi guys, so today we are here with a gynecologist and she's Dr. Sneha.
Hi, I am Dr. Sneha Dhatrak. I am an infertility specialist and laparoscopic surgeon working at Irregular Hospital at Dilshad branch.
So I recently posted on Instagram asking you guys if you have any gynec related questions, and she's going to be bursting some general myths on few important topics, and then we can probably answer some of those questions as well.
So I just went through the questions which you guys had asked her, and most of them were around infertility and PCO. So PCO we'll be tackling one by one. So the first one and the most commonly asked question was regarding PCOD.
Yes.
So PCOD is nothing but it's an acronym for polycystic ovarian disease. So this is nothing but, like the name suggests, polycystic. Many cysts are there in the ovaries. We have 2 ovaries, right? So both of them, they have many cysts. So this is mainly because of hormonal imbalances and all that. Our brain releases certain hormones like FSH, LH and all this. If there is any kind of imbalance between them, then it causes all this. It affects, there is one axis called as the HPO axis, the hypothalamo-pituitary ovarian axis. So those hormones, they act on the ovaries. So any kind of imbalance and all this, it causes PCO. Why does this happen? So as such, we don't have evidence why. We cannot pinpoint it to one particular thing. So mainly it is 50% it is because of our lifestyle disorders. So, you know, unhealthy eating habits, no exercise and all that. Everyone is guilty of it. So am I. But then if it goes out of hand, you know, you eat too much of junk food and then you don't exercise and all that, it leads to polycystic ovarian disease because of the hormonal imbalance.
Apart from that, what are the other main causes or reasons, expected ones?
50% of it is the lifestyle disorder. The rest of the 50% is genetic. So you cannot do anything about it. There is no test to find out about it, and you know, neither you can. So the only thing we can do is we can treat, or we can try to prevent it by maintaining the lifestyle. So exercise, and then try to lose weight. And also maintain a healthy eating profile. So PCOD, the most common symptoms are that the patients, they have irregular menses. So it can be either they can have once in 15 days, they will not have periods for as long as 2 months, you know, 3 months or so, they will not have periods at all. And they can also have infertility problems, difficulty in conceiving, because the ovaries are little, how to simplify it, more resistant. So sometimes the ovulation will not happen. And also it will cause weight gain because it causes insulin resistance. Our body produces insulin, but our body becomes resistant to that insulin, so it produces more insulin. So because it's not working. And all, that's why people who have PCO, they are more prone for diabetes than the non-PCO patients. So that's why it's better if any of you all have any kind of irregular periods or any kind of problem, do visit your gynac. Then let them check you up. They'll most probably get a scan done, do a hormone profile, and then we can get to know how severe it is and what medication we need. We can correct it accordingly. If they have irregular periods, then we can treat that. Or if they want fertility treatment, then we can go accordingly.
How long a period of without periods is something that you should be scared about? Because I think a lot of girls, even questions or in general also, they do have irregular periods, but they think of it as something that happens every now and then and don't take it seriously. So how many months or how long a period is something that they should be scared about?
Now, good ovulating woman, she should get her periods within about 25 to 33 days. Once in 25 to 33 days, she should get her period. Anything which is less than 25 is too short. or anything which exceeds 33 days is a prolonged.
So even if for 1 month, if the period is skipped,
yes,
they should see their gynae.
The most common obviously is pregnancy. But if you are not pregnant, then you have to visit to find out why you have not got.
Yes, I think a lot of younger girls think of it as it happens at times, or they just Google and just leave it. Google is one thing where it gives us multiple answers and you can't trust the answers.
Yeah.
So yeah, you have to see your gynae.
We do have many patients who come over beforehand. They have Googled stuff, so they come and say, "I think I have cancer. I think I have."
Yeah, I know. It leads a lot of times. It leads to very scary things, and it freaks out people. One more thing is a lot of women are embarrassed or too uncomfortable to come visit a gynaec because they either think that they'll be judged, or they think that it is too small of a thing to actually go visit a gynaec and rather Google it. So
I think times have changed now. There are many people who have become more open, and I don't think hospitals look like hospitals anymore.
Yes.
It's become very friendly. So doctors also, I think we've crossed that age wherein we judge other women or other people and all that. There is a very different bond between doctor and patient now.
Yes.
We try to make them comfortable, talk to them. And it's become more of educative purpose also, because when the teens come, they have so many different questions and they don't know whom to ask. Some of them are hesitant to talk to their parents as well. So they do come. And things are better now, I would say.
So there's no need to worry. You should feel free to go visit a clinic.
Yes. So the next thing many of them have asked is about the white discharge, when to visit. Normally during your periods, in between your periods, during the ovulation time, white discharge is common. It is more of the mucus type white discharge, which is not foul smelling, and that is okay. But if in case you have any kind of white discharge which is foul smelling, or which is curdy white, or in different, it is staining your innerwears, then you have to visit a gynecologist to rule out any kind of infections. Also, if it is associated with itching or anything, please do visit so that we can check. We have to find out what kind of infection it is. Is it a fungal infection, or is it something else accordingly? And also to rule out STDs. There are many things. We have to check it out, and then we'll be able to tell you what exactly is the cause for the white discharge.
So there's a lot of questions on, is it okay to use any vaginal wash, or how to take care of your vagina, and even a little bit about menstrual cups.
Care of your vagina, you can normally use your soap and water and then clean it. There is no need for you to use any particular washes.
I think there's this confusion about pH balance, so whether these actually destroy the pH balance, or these kind of washes or any wipes that come particularly for vaginal care.
Actually, the vagina is has a self-cleansing mechanism, so you don't need anything to use in particular.
Right.
But if you are suffering from any kind of fungal infections or any kind of problems, then your doctor would suggest what to use, when to use, how to use, and everything. So don't just go and use those wipes unnecessarily. So they'll tell you if you're sexually active and post-intercourse, if you have to use it, or if you are having if you're suffering from any kind of infections, then please.
And coming back to period care, what is your take on menstrual cups? I think there's a lot of women who are still scared about it. Some people think they're most convenient. So what's your take on it?
I think you can use whichever is good for you, be it the pads, or be it your tampons, or be it your menstrual cups. If you are comfortable with it, you can go ahead and use it. But the most important point comes down to your hygiene related to the tampons or your pads or your menstrual cup. You have to make sure that you use it properly, so get proper information, and then maintain your personal hygiene, and you should be good. There are many questions asked about difficulty in conceiving or infertility. So we give the term infertility. only and only if a couple is trying to conceive for about a year without using any kind of contraception like condoms or oral contraceptive pills or any kind of contraception.
Okay.
After a year, if they are still not able to conceive, then we term them as infertility patient. So if you have any kind of problem as such, visit your doctor. We have to see your profile as such, where the problem lies. 40% it can be male infertility, 40% it can be female infertility, and 20% of the cases they have both the male and female infertility in them. So it's not just the females. Both your husband and wife, both of them have to get checked and accordingly find out what the cause is. And then the treatment.
There were some questions about overweight and infertility. Are those both related, and any suggestions on that?
Yes, extremes of BMI, be it overweight or extreme underweight as well, both of them, they have problems of infertility. The BMI does affect your fertility.
Another common question is about diets. So when it is associated with PCOD, is it okay to follow any particular keto or any particular diets as such? And even in general, when they have some issues with weight and irregular periods, is it okay to follow such diets?
I wouldn't suggest a particular diet as such that you should follow only keto diet or liquid diet or something. Again, depends on your BMI. Be on a proper diet, eat healthy food at proper intervals. Don't starve yourself, but at the same time exercise. There's no point if you only diet and then you don't work it out. You have to do exercise as well. I wrote an article also. Coffee for both men and women. Excess of coffee is bad. Do you drink coffee?
Yeah, a lot. So yeah, that is
down.
Yes.
Excess of coffee is bad because it decreases the sperm motility.
So all coffee lovers like me, we have to be careful with this.
And no smoking. Smoking is really bad. That also reduces the sperm motility and sperm count.
And in general, health also for women especially, I guess.
Yes. It also affects your fetus.
So another thing we were just reading, she was showing me an article that she just wrote, and it talks about aerated drinks.
Yeah.
So aerated drinks are also no.
Yes, they also reduce about 30% of the people, men, they are found to have low sperm motility and sperm count. So it's better we avoid cola.
So there are several of these issues that women face every now and then, starting with periods and then with PCOD or any other hormonal imbalances, or let it be about conceiving. So psychologically, I guess all of us women get affected every now and then because of these. So I just want you to shed light on that and how to take care of ourselves.
You just have to be positive. It's not the end of the world. And please don't Google everything. Visit your doctor if you have any problem. Talk to her. Be open about it. Be honest. And then no one is here to judge you. We are here to help you and treat you. So any kind of issues, don't think you are alone. There are many people who have the same problem. You just have to reach out. Talk to someone. Maybe your family, your friends. If not your doctor, maybe they can come. Maybe they can talk. Stay healthy.
Yeah, and please take care of yourselves.
Yes.
That's the most important thing. So I hope she answered a lot of your questions, and there were a lot of general myths that all of us are confused about. So thank you so much for doing this, Dr. Sneha. And yeah, really, thank you for your time, and thanks for being on the channel.
That was Dr. Sneha answering all of our questions, and apart from this, there were some other personal questions which probably differ from case to case. So which she or a gynec wouldn't be able to answer without actually, getting a consultation or seeing the personal case. So for those, you'll have to make an appointment with her, and I will leave her link in the description box so that you can make an appointment. She is at Hegde Hospital, Dilshuk Nagar branch. I will leave her Practo link so that you can find all the details there, and also let me know in the comments below what other videos you would like to watch. And I upload every Monday, Thursday, so make sure that you're subscribed and also hit that bell button so that you get a notification. And I'll see you guys in the next video. Bye.